Hello, and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today are friends from Caldwell Hospice and Palliative Care, Dr. Julia Scher and Brittany Bond. Welcome, ladies.
Thank you.
Thank you very much.
With COVID, you've been facing a lot of challenges, but you found some really unique ways to overcome those challenges. One of those is telehealth. Tell me about your telehealth program.
Well, I'll share a little bit, and then I'm going to pass it to Dr. Cheryl because she's actually gotten to do this. But we looked at ways that we could make our patients feel more secure. And, of course, our team is always available for hands-on care for our patients. But for patients who are concerned and wanting to be cautious when it comes to allowing folks into their homes, we have the option of providing telehealth. This has also been really helpful at our partnered long-term care facilities, some of which have had to restrict visitors in order to protect their residents. So we have been able to work with them in various ways to use telehealth to support their patients and to continue to be there for the things that they need. So I'll pass it to Dr. Cheryl and let her tell us a little bit about her experiences using telehealth.
So I think that something we've always wanted to do. I mean, a lot of areas of healthcare have wanted to do telehealth, but it just kind of got pushed into fast forward since we needed it. I think one of the first experiences I had was wonderful because it was a family that just didn't want extra people in their home exposing them potentially to COVID or any other diseases, really, because their immune system is low, which is a lot of our hospice patients. So it was just a really rewarding experience because they were happy because they still got the care they needed. The nurse was still able to visit, but they were also able to get a physician visit as well as any of the other things that we offer, like social work and chaplain. So it's just been really neat. So we do that in the facilities, we can do it in the home, just really wherever they're at.
And before we started, we were talking a little bit about telehealth in the facilities. Mm-hmm. Brittany, tell me a little bit about what that looks like.
Well, we were, the program that we use is called TapCloud, and it's actually super user-friendly. So we are able to just send an invitation to either a phone number or an email, and it's kind of a one-click connect for the person who's using it. But particularly with our facilities, like we were saying, several have had to restrict visitors, including part or all of the hospice team. But we still need to be available to that patient to help with symptom management, to help with any kind of needs that they have for their care. So some of the creative things that we've been able to do are to allow maybe one staff member, like the nurse who serves the patient, to go in, and then when that nurse gets in there, she can actually connect with any of the other team members. So that could be the chaplain on the team, the social worker, or the physician, and be able to help facilitate a visit with that patient. So they still get the hands-on care, but they have the eyes-on care for the rest of their from the rest of their team as well. So they don't ever lose that additional layer of support that hospice offers. We've also been able to, for facilities that don't allow our team to come in for right now, whether it's because they have an outbreak and they're trying to make sure to contain that and protect the rest of their residents, or if it's just out of an abundance of caution, we've been able to actually let them check out an iPad, or if they have one of their own, we can use it as well. And our local long-term care facilities have been wonderful to work with us and to take some time out of one of their staff members' days to help facilitate these visits so they can sit with this patient and the patient can still have a face-to-face virtual conversation with their hospice team. So we have done some great collaboration with these long-term care facilities, and like I said, they're doing great work. So
how are your patients and families receiving this? Because this is all new and sometimes technologies can be a little scary. So how are they taking it?
I think that they're handling it pretty well, and we've been really blessed to be able to have some good experiences with families. We actually have been able, there was a patient who moved to one of our local long-term care facilities. The patient was COVID positive. The facility was dealing with an outbreak, so the family was not able to visit in person, and we're not comfortable doing so because this was an elderly patient with an elderly family member. we were actually able to go in, our team went in, garbed in PPE, following all of the CDC guidelines, and was able to facilitate a goodbye visit with this patient and his loved ones. And it was a wonderful thing. And I know that Dr. Cheryl has gotten to have some experiences, great experiences with families.
I mean, it's nice even just for families that, and you can't really travel right now either. So you have people in different, doesn't matter if they're in different areas of a county or state or in a whole different part of the country, it really doesn't matter. We can pull in multiple different lines, so you can have multiple numbers or multiple emails and have all the people. So you could have 5 family members in all different places and all of them be on the screen together with their loved one. And that's just been a wonderful experience, really.
As we hopefully soon move out of this COVID crisis, how will you continue to use telehealth?
I can see telehealth being a new part of our lives in, not only in healthcare, but in any setting. I can see, these virtual connections being something that's here to stay. And like Dr. Cheryl was saying, when we have family members who are out of state, who are out of town, and who, we in the past we would have held a phone to that person's ear. Today we can have, you can have that face-to-face connection while still maintaining that patient's privacy, because that's something that's important. A lot of us have the ability to FaceTime or to use Google Talk or any of these kinds of services, but the connection that we use is a secure connection, so that we can share medical information and not have to
Right.
worry about anyone's privacy.
Right.
So I can foresee this being something.
Yeah,
that
I
we're-
think it is here to stay, for sure.
Dr. Shell, you were talking about being able to have 4 or 5 family members on a call with a patient.
Right.
Tell me a little bit more about that and what it's like for those family members, because I can only imagine being a family member out of state and being very concerned about my loved one and
Right.
wondering if my sibling is giving me all the information. But
Right.
to be able to sit there and see the hospice doctor, for me, that would be an incredible experience. Can you just talk?
I feel like they're very grateful, for one, just that they can all be together. So you can have that family meeting that we might normally have with everybody there in the room, but they're not, but it feels just the same. They may not be able to touch their loved one like they like, or hold their hand, or give them a hug, but everybody can see each other. It's a really clear picture, so you can see the expressions. You can still see that, which I think for a phone call is sometimes difficult. You can't judge, what's going on as well if you can't see somebody's facial features and what kind of expression they have. So there's been a lot of just people being very grateful and just joyful that they're able to see their loved one finally. I think we see that a lot in our long-term care facilities,
Definitely.
because they just can't go in, and now they can. In a way, they feel like they're able to go in and they can still see the environment, and that gives them a lot of just peace. I think that they're able to see that.
And for you as a physician, there's some efficiency there,
There is.
because you're not traveling necessarily
Right.
to all these places. So there
So-
is that part of it too, I'm
we,
sure.
we service a lot of counties, and I'm actually based up in the High Country area, so I can see people, doesn't matter how far they are. If the nurse needs me to see somebody in Caldwell County, but I'm in High Country for the day, there's no barrier there. So that's been nice too.
Definitely.
What other technologies are you using?
Well, we have received a grant in order to provide, this is so neat, in order to provide VR goggle experiences for our patients. So one of our team members went through a certification process to learn how to use this technology, and we've been able to facilitate some amazing experiences. The first one that comes to mind for me is a patient who was a Vietnam veteran, and his dream was to go and see the Vietnam Memorial in Washington, D.C. And because of his condition and because of the world that we're living in with the, with the restrictions on travel because of COVID, he's not able to do that. So she was able to let him experience a virtual tour of the Vietnam Wall. And Dr. Cheryl, you were saying he got to do a couple of
different memorials and museums. I mean, there's a lot of capability with the VR goggles for people to see something that was maybe on their bucket list, and now they can do that.
And for people who are not familiar with VR goggles, it's more than watching something on TV,
Yeah.
right?
Yeah.
So it's to feel like you're actually there,
Yeah.
like you're walking through the museum or the memorial or Walt Disney World,
Yeah,
whatever it may be.
exactly.
It feels like you're actually there.
Is a really immersive experience for the patient. And speaking of Walt Disney World, we were able to have a lady do a tour of Walt Disney World. So it was a similar situation. She had always wanted to go to Disney and had never been able to, but she got to have that experience as if she was there. So it's just a wonderful thing that we are so blessed to be able to offer to our patients. So,
And again, you got this through a grant, but Caldwell Hospice offers so many services. And how are you able to do that?
well, we are very blessed with the support of our community who we serve. And we are very blessed with a board who always makes the decision to do what's right for our patients and to do what's best for our patients, and to make sure that no matter what the financial situation is, we care for our patients regardless of their ability to pay. So,
And we've talked a lot about virtual visits, and I think it's important for you to share, where are your patients?
well, I love that you're asking me this, because a lot of times when people think hospice, especially in our community, they think one of our patient care units. We have one in Lenore, the Stevens patient care unit, that has 6 beds, and then we have one in Hudson, the Four Lines patient care unit, that has 12 beds. Well, we serve upwards of 220 to 230 patients a day in hospice care. So obviously, all those patients are not at those 18 beds. So the majority of the patients that we serve are in their own homes. So our team goes to them and does whatever they need when it comes to their comfort, symptom management, education for their family, and the things that hopefully will help them stay in their home if that's what they want to do. We also serve patients at our local long-term care facilities, so assisted living communities and long-term care communities, skilled nursing facilities. So we serve patients there as well. We follow patients and continue to support them when they go to the hospital. And then, of course, our patient care units are available to them. So if they have acute needs. So if they have a symptom management issue, if they have a pain issue, if there's something going on that can't be managed at home, we can bring them to our patient care unit, help get those symptoms under control so they can go back home and enjoy their time. We also can provide respite care. So if their family needs a break or has something coming up where they need to know that their loved one is going to be well cared for, they can come and stay for up to 5 days. In order to facilitate that for the family. And then we also have residential level of care. A few of our beds are designated for folks to come and stay with us. So
So really, it is the gamut. And when you talk about
Right.
telehealth, you do it wherever.
yes.
Right.
So that's amazing. Is telehealth used for your palliative care patients?
It has been, yes. We actually, and Dr. Sherrill, please chime in if I missed anything. We actually we'll follow up with our patients, or we'll reach out to them prior to our visit, and we do a series of screening questions, and then if they would prefer that we visit remotely, if we do a virtual visit, then we send the invitation and do that. If not, then of course we go hands-on care and we take care of them.
So really, telehealth is across the board.
Yes.
It's called a
Right.
hospice and your High Country Hospice.
Yes.
Right.
We've also talked about another service that you're providing using virtual means, and that's your advanced care planning.
Yes. We have collaborated for a long time in Caldwell County with the Caldwell Senior Center to provide a opportunity to come and complete your advanced care planning documents, which are your healthcare power of attorney and your living will. And since we've all been dealing with COVID, and since we've been through the shutdown, the senior center has been closed, and we had postponed, or we had temporarily stopped those appointments, but we have now started to offer that class again virtually. So basically, if you would like to complete those documents, you can call the Caldwell Senior Center and register. We'll make sure that you get a packet of information about the documents with a physical copy of the document. Will come to you prior to the class, and then we'll sit down, we'll go through the documents together, answer any questions that you may have, and then we have an opportunity. Those documents require notarization. So if you need help with notary services, we can do that by appointment after the class.
So really, you're looking at all kinds of ways to serve.
Yes,
Right.
definitely.
Is there anything else with hospice? I know there's so much going on with hospice, and I feel kind of stupid asking that question, but because there's always so many things and so many ways you're serving.
Well, I just would like to remind folks, one of the things that we have talked about is that trying to make sure that your safety is protected shouldn't stop you from accessing the level of care that you need. And just making sure that the folks in our community know that if they're dealing with a terminal illness, if they're dealing with a limited prognosis, and if they're dealing with a serious illness, but not necessarily a terminal prognosis, that either hospice care or palliative care can support them. Our team is following all of the guidelines that have been mandated, or not mandated, but laid out by the CDC, and we're screening daily and ensuring that we are safe, we are well, so we can continue to provide that care for our patients.
How do people make a hospice referral? And who makes a hospice referral? Or
In-
palliative
Anybody
care?
can.
Anybody can. All they have to do is call our hospice, which I'm sure we can probably put the number.
Yes.
And all they have to do is call, and they can touch base with a member of our team, let them know what's going on, and we can move forward with beginning services for them.
We've had patients self-refer, we've had families refer, we've had their primary physician refer, or a hospital refer, so really anybody.
And as I think back to telehealth, we talked about the patient visit, but you've also connected with some families to answer their questions as well, right?
Right, yeah.
So it's really been across the board that this has been
Right.
used.
Yes, it has been. It's been a blessing for us to be able to maintain the level of collaboration and connection that's necessary when you're providing the level of care that we provide to the population that we provide it to.
One
So
more
for the whole
question.
patient.
Yeah,
Yes,
for the whole patient.
exactly.
One more question about referrals. What if I'm just not sure about what my loved one needs or what I need?
Well, if you call, and then somebody would come assess you. So if a patient themselves wanted to refer, or their family did, they'd call. They'd go through a series of questions that we'd ask, and then there would always be somebody that could actually just go assess them and help them decide, what kind of services would be best for them.
We have an entire team in place that handles referrals, and we take care of reaching out to, so if you were to self-refer, we take care of reaching out to your doctor and getting any information that we would need from them. All of that is covered. All you have to do is make the call and ask for help.
And again, people who've lived in Caldwell County for a while are probably familiar with Caldwell Hospice, but your services have expanded to the High Country.
Yes.
What counties are you serving in the High Country?
So we're in Ashe County, Watauga County, and Avery County. And of course, that's just the 3 extra, but there's still
Yeah, and then
obviously this area as well.
Yeah, we serve Caldwell County and all of our surrounding counties. We can go into Burke, Catawba, Alexander, and Wilkes County. So
So it's really quite expansive.
it is. It is. So.
Ladies, anything I've forgotten? I know we've kind of wandered around and gotten a little off subject, but anything I've forgotten today?
Well, I always just like to remind folks that when they're considering whether or not to use hospice services, because as we were talking about, a lot of the folks in our community are familiar with our services. They're familiar with our patient care units. Hospice is not necessarily the end of the road. Hospice is a treatment option that provides comfort, that ensures that your symptoms and needs are managed, and that ensures that if your desire is to stay home, that our team's going to do everything in their power to help you stay there. So if you feel like you could use some help with pain control, with symptom control, with just education about your disease, hospice care is a wonderful option for you. And if you are not in that window of having a terminal illness with a limited prognosis, if you're just living with a serious illness that is causing, it's causing you to not be able to live your life fully, that's where palliative care can come in. That's more of a consultative service. It's provided primarily by nurse practitioners, and then our hospice physicians also are there to support those needs. We pull in social work and chaplaincy as it's needed for those patients in order to help them manage their illness, collaborate with their doctor, have discussions about what are your goals for your care, and have you done your advanced care planning documents? And you have a higher level of clinical support in your home, so that helps with your primary physician who you still see, your specialist who you still see. You just have this, higher level clinical support in the home that allows this person to collaborate with them and say, this is what I'm seeing, when this person's at home. And so let's talk about what we can do to make sure that their needs are met.
And since you opened this door, I'm going there. Talk about the window for hospice care.
Okay, so hospice care is for folks, like we were saying, with a terminal diagnosis, with a prognosis of 6 months or less. Dr. Cheryl, you can back me up. That's not always necessarily the case.
So basically it's if their particular illness or multitude of illnesses in the normal course of things. So just if we looked at 100 patients that had that same outlook, that likely they would not live more than 6 months. But again, everyone is different, and so we take each patient individually. So even though we might say that, everybody's different. So.
And speaking of everybody being different, I've done enough hospice interviews to know the earlier someone gets into hospice
Right.
care,
The more we can do.
the more you can help.
The more we can do. I know I read a study recently that said that patients who are enrolled in hospice care for, I believe it was for, a roughly 6 months period, live on average up to 28 days longer compared to folks who do not
Right.
access hospice care. And I can say that just seeing the care that we provide at Caldwell Hospice, that we serve a lot of patients for 7 days or less.
Right.
And that, for us as a team, we're honored and we're grateful, and we're happy to be able to be available to those families and help them through that crisis. But if we can be involved sooner, then we can hopefully keep the crisis from happening.
Right.
And make that a smoother transition and a smoother end.
Yeah. That's what we always hope, is it?
That's the goal. So,
And we've talked a lot about the patients, but the families are also key in hospice care.
Definitely.
100%.
We follow them even after death. So any kind of needs that they need, for bereavement, we do that after for a little over a year. So any kind of needs that they have afterwards, hospice is not just for the patient, it's for the whole family.
And the access to the education that the family can have, because I don't know if we've all had the experience of caring for someone who's ill in the home, but that can be very overwhelming and it can be very difficult. And if you've never had that experience before, you have no idea what you're doing. So having access to a nurse who can show you how to safely meet your loved one's needs, to a social worker who can help you access resources and have the things in place for your loved one, and two, I mean, a chaplain to help with your spiritual needs and say an extra prayer for you. And then, of course, CNA services up to 5 times a week. So that if your loved one, needs a bath, you need help with transferring, all the kinds of things that our CNAs can come and help you do to make sure your loved one's comfortable and to make sure that you aren't completely overwhelmed. So, and you have access to that nurse and that social worker 24 hours a day. We have on-call services, so if you get into a bind at night and you don't know what to do, you always have someone that you can call.
And that's all the time. That's not just during COVID. That's
Right.
Yes,
that's year round, regardless.
24/7. Yeah.
And talking about the CNAs, telehealth does not replace the CNAs.
No. Mm-mm. And we still, and like I said, as long as the family is comfortable with us coming in, we're going to come. And we're going to make sure that their needs are met. And then, of course, at our long-term care facilities, we work with them and we collaborate with how we can best meet those needs. So, our team is still accessible.
And really, you're partners with the healthcare providers and the family. So
Exactly. So,
thank you both for coming and for answering all my questions and for what you're doing and how you are taking a very difficult time and using technology to make that easier for patients and families.
Thank you for having us.
yes,
you.
we appreciate it.
And thank you for watching Caldwell County Today.